Hi, welcome to NYC Health and Hospitals Kings County YouTube podcast. My name is Lisa Rose, and I'm the Assistant Director for the Neonatal Intensive Care Unit. And on this episode, I am here with Audra Longmore, who is the head nurse in the NICU, to discuss pasteurized human donor milk.
Hello, everyone.
So the neonatal ICU, otherwise known as the NICU, is usually where infants who need special monitoring are placed. These babies include premature infants who are born at less than 37 weeks gestation, extremely premature infants who are also called micropreemies. These babies are born prior to 28 weeks gestation. Low birth weight infants, infants born to insulin-dependent diabetic moms, those who require breathing support, and infants who may need surgical intervention. Pasteurized human donor milk is utilized in the NICU. It is donated by women to a milk bank, and there the milk is put through a heating process to destroy harmful microbes. It is considered to be human tissue. A consent needs to be obtained from the mother prior to it being offered to a baby in the NICU. It is given to infants at less than 32 weeks gestation, or an infant weighing less than 3 pounds. The other name for it is PDHM, and it is used as a supplement when the infant's own mother's breast milk is unavailable because it may take time for a mother's milk to be produced. Infants whose mothers have HIV, or to premature infants who are at risk for necrotizing enterocolitis, otherwise known as NEC, which causes death to an infant's gut. Formula feeding increases the risk of NEC, which happens due to prematurity of the neonate's gastrointestinal system. Formula is less easy for a premature infant to digest.
Okay, so it's Miss Longmore again, and I just want to discuss the responsibility of safety in administration of PDHM, otherwise known as pasteurized donor human milk, and that of the nurse's responsibility. So the first thing that we do, we confirm that consent for PDHM is in the patient's chart. We also want to perform barcode scanning to ensure the right patient is being given the PDHM. We further verify that the right patient is receiving the right milk with the signature of a second nurse. PDHM is stored in a specialized freezer at -20 degrees Celsius for 6 months or until the expiration date listed on the bottle by the milk bank. Upon receipt of the milk, the nurses must confirm that it has remained in a frozen or solid state. If it is melted or slushy, we are obligated to inform the milk bank immediately for replacement because it cannot be used. Once the PDHM is thawed, it may be used for up to 48 hours and it is labeled with the new expiration date and time. It is discarded at the end of the 48th hour. So some of the advantages of the pasteurized human donor milk: it contains vitamins and nutrients the baby needs in the first 6 months of life. If it is packed with disease-fighting substances called antibodies that protect your baby from illness, this protection is unmatched by any formula or commercially produced product. Breast milk, whether from a donor or the patient's mother, is easier for a preterm or low birth weight baby to digest. The value of donated breast milk for micropreemies has actually been measured. Studies show that extremely premature infants who were fed donated breast milk had less than half the rate of a life-threatening disease than those who were fed formula. So we also have disadvantages of donor milk. Some of it are the risk of transmission of disease via the antibodies in breast milk. Donor milk tested for multiple diseases, for example, HIV, hepatitis B and C, but testing may not be 100% effective. Exposure to medications that the donor might have taken. And last but not least, expensive hospitals bear the cost of storing, preparing, and supplying the milk, even when the milk itself is covered by insurance.
Thank you for listening, and thank you to Audra for sharing this insightful info.
Pleasure's mine.
Stay tuned for the next episode.